Welcome to Knovva Academy. My name is Alex Krasser and I'm head of online learning. We're very excited to present the Pandemics and Public Health Initiative designed to help teens around the world be better informed about one of the most impactful events of the modern era. The COVID-19 pandemic is an unprecedented challenge to our modern systems of healthcare, our economies, and our systems of governance. Global collaboration is more essential now than ever. But what does that collaboration look like? What should we be doing to tackle this crisis, and what are we actually doing? We're very fortunate today to be joined by Dr. Jing Ma, Associate Professor in Population Medicine at the Harvard Medical School and the President and Secretary General of the U.S. China Health Summit. Dr. Ma, thank you for joining us today. In a few words, could you introduce yourself to our students and describe a little bit of your background?
Thank you, Alex. My name is Jing Ma. I came from China 30 years ago, more than 30 years ago. And I was trained in medicine in China and also public health of master degree. And I came to the United States to gain my PhD of epidemiology. And then after that, I started to work at Harvard University Medical School since 1994 as an epidemiologist. Yeah.
All right, very impressive. And it sounds like you have a load of experience from all over the world. So we're excited to learn from your experience. Are you able to get directly involved in the fight against the COVID pandemic? And if so, what are you able to do?
I try to help. So that's, fortunately, I'm working with my colleagues, my friends, my many volunteers at U.S. China Health Summit. And we start to work right after the announcement of the outbreak in China, in Wuhan. So we quickly organized and mobilized volunteers, not only on donations and the PPE support, but most importantly, we called ourselves as the intellectual supporting group. So we trying to use our knowledge, our public health and medical background, even some ITs, and we quickly collect information, and we do analysis, and we're trying to provide as much scientific-based evidence as possible. First, early on in China, to China, and now we're trying to forge the connection between China, US, and the world.
So it sounds like you're doing a great job of not just connecting experts with each other to share information, but also sharing information with the general population.
Yes.
So you mentioned the field of public health. And I know that you're an expert in population health, and I was wondering if you could describe what the difference is, or what is population health?
Good question. I was trained in public health, and in Wuhan, China, in Tongji Medical University, where they have the hardest hit, and that was about a long time ago. I should not say the years, how many years. But at that time, we were told public health is the occupation. You care about the sky, the air. Basically, you care about air. You care about earth, environmental health, and you care about people. So anything outside of hospital, you will take care about, right? In terms of people's health. So public health is really a collective of field to take about people's health as a whole and in an organized way. And population health is really a relatively new definition, which has been emerged in the late 1990s. To me, population health has been defined as the health outcomes of group of individuals, including distribution of such outcomes within the group. And to me, I think population health really cover the spectrum of people's health, not only non-disease people, but also in the healthcare system. So it's really emphasis on the patterns of health determinants. The determinants means what decides your health status before you get sick, and what determines of care after you get sick, and what determines how soon you get recovered. All those, in the old fashion of public health, with too much emphasis on some non-social determinants. We talk about germs, we talk about environmental factors, we talk about occupational factors, physical factors. But right now, as the knowledge grows, and more and more we understand there's so many social determinants other than physical, other than biological factors affect your health and your health care recovery. So based upon that, we can make recommendations, we can do research, and we can make recommendations to policies, and also we can conduct interventions. These kind of interventions, not only for drugs, but also for the society as a societal experiments. And then we watch how those determinants, how those interventions will make different kind of health outcomes. And the last one, everything needs $1. So population health also pay attention to induce the reduced per capita cost by doing those interventions, doing those campaigns of population health. So to my understanding, population health covers including public health, but has much more beyond that. It has also involved healthcare delivery organizations, hospitals, community health centers. It also has education and income. So overall, population health has a much broader spectrum, I should say, than public health by itself.
So along those lines, there's been a lot of talk in the news about COVID-19 patients and their symptoms and how possibly to cure them. But in the interest of population health, everybody is being affected by this, whether they have COVID-19 or not. And so I'm very curious about what research is being done, or what questions do we have about the effects of the pandemic on everybody's physical and mental well-being? What is the impact of lockdowns and isolation, for example?
I mean, fortunately, we can link through this new way of communication like this. We can talk, we can still see each other, but that's very different from personal contact. And we have to have this anxiety there. Not to mention about families getting infected, not to mention about nursing homes, not to mention about those healthcare workers working in the front line. They have to risk their lives on a daily basis. They have to go to nursing home to take care of old people. They have to go to hospitals to take care of the sick people. And a lot of people staying home feel lonely, feel isolated, feel depressed. So the whole world is changed. I don't know how many research we need to be done, but right now we haven't seen much of the research how that changed people's behavior, how that changed people's mindset, and not mention about anxiety and depression and even like chronic diseases. And I do hope our audience, our young people, really think hard about what's the future. The future belongs to young people in how we live, how we take care of this world, this globe. Not only global warming, but the whole nature.
So you've mentioned some of the work your organization does to help spread information around the world. And I know that a lot of people are trying to find a balance between watching the news and staying informed, but not being too informed to the point where it impacts negatively their mental health, and also trying to get information from reliable sources, so that we know, so that we can have a realistic understanding of what's going on.
Right now, the booming of all these kind of media really, on one hand, it's good. It spread news very, very fast. What happened on the other side of the world, we'll immediately see on this side. That's a good news of information sharing, which is very, very important, especially with the infectious disease, because people travel all the time, and we need to know as soon as possible what's going on at different corners of the world. But as people staying home, or I don't know what kind of motivation, there's so many rumors around, and unfunded evidence, unfunded information. As a teenager, as people, we should really use our judgment to try. Us as a scientist, we're always trying to prove. So I always ask our volunteers, we produce information has to be based on the solid evidence, and we have to cite each information we produce. We have to have a resource. Most reliable resources are peer-reviewed scientific papers, research, but even that, we still have daily newses. So we tend to trust the major stream of newses, and also I'm a fan of NPR, National Public Radio. So I trust their information, and also I trust their very in-depth, on point, etc. Kind of discussion, and we trying to use our best judgment. And I'm glad Dr. Fauci, U.S. has him as a chief scientist in this pandemic, and he always, make corrections and make the right direction. Or even though sometimes he explained to us bluntly, this is something I don't know. We're still under research, right? We have to have that kind of scientific attitude, and we use our best judgment and try not to spread rumors. Science can save the world. Not only the science, but science can save the world, plus the right policies. Yeah.
I completely agree. So you mentioned how valuable it is that the news allows us to find out what is happening on the other side of the world. And that's so important, especially today, because in the past, especially 50 years, globalization has completely reshaped the way we live and work, how we manufacture things, how we communicate.
Globalization has been affected by this coronavirus pandemic. For instance, the medical equipment supplies. All of a sudden, U.S. realized there's so many essential medical equipments are all produced in the third world, and you have to go around to search. Of course, China also provide a lot of support through a lot of people, American Chinese communities and other big companies, and help to mobilize the PPEs masks and ventilators. But again, so many essential equipments. To my, I think the government believes should be also, have the capacity to produce locally. And globalization also, I believe, make the richer, the rich people or companies richer, and left many low-income people. I should not say poor, but not catching up. And that really comes back to our social determinants of health. And with our globalization, with economic development, I think everyone has the right to have a fair share of the development, have to have the fair share of the profit, the benefit, and especially the essential cares, food, nutrition, and medical care. They, as a government, as the big companies, as the whole society, we should not let people behind. And that's what our young people should think hard through education, through healthcare, and through many social supporting programs. And that's really something this world need to be rethinking about this globalization. Globalization doesn't only mean economic development, but also means education, social welfare, and many humankind, environmental protection, greenhouse effect. The whole world need to have a global solution. U.S. cannot solve it. China cannot solve it. Individual countries cannot solve it. And so we really need to think about this globalization as a broader scope, a broader view to address global problems. Yeah.
So hopefully this pandemic will have helped us realize the importance of not just economic globalization, but of education and access to healthcare and whatnot.
Yeah.
So as we talk about trying to get the world back on track economically, obviously there's a tension between maintaining social distancing, which will help keep people safe, and the economic impact of social distancing.
It is true. Harvard professors, my colleagues, have proposed that this could be a new norm of keeping social distance in the near future, next year or for the following year, which is still under debate. But we have to be prepared, mentally prepared and physically be prepared. And so it is relatively easier for us. We can work at home. For people working in the office, computer related, information exchange related. But it will be hard for those people who have to go to factories. For instance, like a meat processing factory. And a nursing home caretakers, they have to go to take care of those people who are needed. So there's so many occupations. It is very hard to keep social distance. But this social distance, we have to have this mindset. We have to be prepared. I think social distance is necessary, especially during this pandemic period of time. But what I'm saying is, mentally we have to be prepared, but even more so, we have to be prepared to have a stronger health status. Prevention is the most important. Prevention means we have a physical measures, like a physical distance, like washing hands, like wear masks. Those are all physical measures. But we need also to have a healthier body in order to against or prevent the virus, or even though we get the virus, we can only have milder symptoms. For instance, data have shown majority of the people have severe case of coronavirus, or people who died are either old people or people have chronic disease conditions, hypertension, diabetes, kidney problem, liver problems. That really gives us a warning. We as young people have to grow this healthy behaviors, healthy lifestyle to keep our body stronger so we can fight not only coronavirus, but any kind of virus, any kind of infection, any kind of diseases. As a preventive, as a population medicine, population health researcher, I have been spending the past 30 more so years studying determinants of health. Means nutrition, means exercise, means sleeping. You need to maintain a good sleep in order to have a good immune system. You need to have a positive mental status in order to have a strong immunity system. Everything is linked. So I know my kids too, you guys, young people, like to play computer games, like to not sleepless the whole night. I should warn you, from now on, keep a healthy body is more than ever important. And in that, you can have a stronger body. Even though stay home, you can still exercise. So again, keep your own health is the better than ever than keep distance, I should say.
Thank you for taking the time to speak with us today. And I'm so glad that we can provide an opportunity for you to share your expertise with our students.
First of all, I thank you for your invitation of this webinar and to give me this opportunity to communicate with high schoolers because and with a broader audience. Health education is very important, and through this, you just mentioned how people can get true scientific information. It is only through this type of communication and channel we can communicate with a broader audience, a public, especially young people. They are the future. Thank you.